Good evening. Welcome to Left, Right and Centre. I'm Vishnu Shom. Just when you were convinced that it was a matter of time before we fought off COVID, comes news of a new, potentially far more aggressive mutation of the COVID virus, primarily in the United Kingdom, but which has now resulted in a travel ban to that country, from that country, to at least 30 other nations, including India. And the biggest worry is that we just don't know if the vaccines which we now have will be as effective against the new mutation which has been raging across the United Kingdom. On the show tonight, two of the most important voices on the mutant strain of COVID. Dr. Soumya Swaminathan joins me in a few moments. She is the Chief Scientist at the World Health Organization, also joined by Professor Devi Sridhar, Chair of Global Public Health at the University of Edinburgh. But first, what is this new COVID strain all about? We have this report. With a transmission rate of 70%, the new mutant strain of COVID-19, revealed first on the 14th of December in the United Kingdom, represents one of the biggest global challenges since the virus went global almost a year back. Now, it's not that mutations in viruses are uncommon. In fact, there are hundreds of mutations to COVID already. But what we are seeing here are not just a large number of mutations, but mutations in the spike protein. What is that? That governs entry into human cells, and the impact seems clear. What you'll now see is a graph of the United Kingdom from the 1st of October to the 18th of December. Now, the blue bars are the original COVID virus. But as you can see, there is a jump in the so-called S gene variant. Now, this mutation has been detected in Denmark, Australia, Italy, and the Netherlands, countries which carry out sequencing of the virus much more regularly than other countries. Now, this is important because without sequencing, we don't really know how widespread the new strain is. Remember, a standard RT-PCR test throws up COVID, not the type of strain. And it's not just the United Kingdom. South Africa is also reporting a new aggressive strain. It is different from the UK one, but now is also surging among new infections. Worried at the prospect of an altogether new threat emerging, a parting shot, if you will, from 2020, more than 30 countries, including India, have invoked travel bans. And at the moment, there is only hope to rely on. But while it is believed that the new vaccines will protect us from the new mutation, we still don't know that for sure. According to Dr. Siddharth Mukherjee, one of the finest writers on illness in the human body, if one of these strains was to become resistant to the vaccine, then the entire effort to vaccinate will become moot. Well, joining us now, Dr. Soumya Swaminathan, Chief Scientist at the World Health Organization. Thanks very much, Dr. Swaminathan, for joining us. My first question to you, ma'am, will the vaccines which we now have give us protection against this new mutation?
Thank you, Vishnu. I think your question is very pertinent, and I think everybody's interested and worried about what's going to happen about vaccine efficacy. But I think it's too early to really conclude either way. What we do know is that the number of mutations, the number of changes that has occurred in this particular variant is larger than normal. So there are about 22 or 23 mutations which have occurred. And several of them are in the spike protein region, as you mentioned. And that's the region, that's the protein that's being targeted by most of the vaccine developers, at least in the first set of vaccines that are coming out. But it's the vaccines, that the spike protein itself that's part of the vaccines would generally elicit quite a broad immune response, both a neutralizing antibody and a cell-mediated immune response. And it would be unlikely that a couple of mutations in the protein would actually change the response of the immune system to the vaccine. So while we have to wait, and the investigations, the lab experiments that are going on now that are taking this virus in culture, adding serum either from recovered patients, so convalescent sera, or serum collected from vaccine recipients, to see if this virus can be neutralized by the antibodies that these people have. Those experiments are going to take a couple of weeks for us to get results and would definitively tell us the answer to this question.
Dr. Swaminathan, is it possible that the travel ban which we now have, which probably makes a great deal of sense for so many countries around the world, could in fact last for several months? The reason I ask is it's at a stage like this when you want people to be vaccinated as soon as possible with the hope that the vaccine does work. And until the United Kingdom brings down its rates, then would it be safe to open up travel to the UK? And to bring down the rates in the UK would take time. That's the key issue. You can't have it overnight. It would take a few months. So could this be a protracted travel ban?
So a couple of things I'd like to say in response to that. The first is that we're going to learn more about this strain in the coming days and weeks. So the questions that we're interested in is it more transmissible? Does it, infect, go from person to person much more easily? Does it result in worse clinical outcomes? Is it more severe clinical disease? And thirdly, does it have an impact either on treatments like monoclonal antibodies or vaccines? So we only have a hint about the first question. The UK scientists who've done a lot of modeling around this, and you showed the explosive growth of this variant in the southeast of the UK over the last few weeks, suggests that it's more transmissible. But there have been mutations in the past which have also become the dominant variant going forward. So it may be just another variant that has an advantage in spreading and therefore becomes a dominant strain. So I think we need to wait for those. But on the travel, the first thing I'd like to say is that the UK is one of those countries that's doing a lot of whole genome sequencing and therefore is able to track this, very closely in real time. I suspect that as more countries look at their whole genome sequencing data, and we encourage countries to do much more sequencing than is being done now, that many more countries might find that this variant or related variants might already be in the country. Several European countries have already reported the presence of this variant. And because it's been in circulation since September, so it's likely to have spread internationally. And I think the more we look, the more we will find. The other important point here is that whether it's this variant or another variant, the public health measures are the same. And it's really important that all countries now put in place measures to control this virus and bring down transmission to as low levels as possible. And we know what those measures are, the testing and the tracing and the quarantining and the isolation of the positive cases. So those measures need to be put in full, place regardless of which variant it is.
So Dr. Swaminathan, tell us a little bit about sequencing. Some countries do it a lot more than others. How much time would it actually take for countries sequencing with the best equipment available to actually know about the variant or the strain of the virus? How long does it take?
Doesn't take long at all. So countries that have the capacity, India, for example, is a country that has huge capacity to do whole genome sequencing. We have labs across both in the private and the public sector that are doing it. In fact, India is contributing quite a lot of sequences to this global database called GISAID, which currently has close to 300,000 whole genome sequences. Several parts of the world are underrepresented. Asia is relatively underrepresented, and so is Africa. So a lot of the sequences have come from North America and Europe. So I think the more that these countries are able to do and deposit in this database called GISAID, the better. Because this also allows scientific collaborations globally and scientists to work on looking at how the virus is really evolving and changing over a period of time. And you can, many countries have used sequencing to understand their epidemiology, to understand where the infection and when it entered their country and how it has actually spread and where the clusters are and whether there are any dominant strains that are coming up over a period of time. What we need is a national database. We have a global database, but it would be also good to have like a national database of whole genome sequences where all the agencies come together and collaborate and work together to track how this virus is behaving in India.
All right, Dr. Swaminathan, thank you very much for joining us. Sequencing is so important now as we go ahead and try and fight this, but the basic measures need to remain the same to protect all of ourselves. Well, joining us now, Hilary Hudson, the head of Travel, Transport and Logistics Practice at FIPRA. Thank you very much for being with us. She joins us from Belgium. Just for the benefit of our viewers, the United Kingdom and travel from the UK to other countries is huge. If 30 countries have invoked a ban now, possibly many more will, what are some of the numbers that you can share with us in terms of how much air travel will be impacted, not just in Europe, but across the world?
It's been incredible, the impact that we've seen already. I must say the numbers coming out of companies like IAG, the owners of British Airways and Iberdrola, they're down about 10%. And we've seen Heathrow have said that putting an absolute number on how many flights have had to be cancelled has been difficult for them because the circumstances are changing all the time. Airports like Gatwick in London as well, they normally have something like 700 winter flights. That was already down to 200, and I think already today there's been 46 other flights cancelled. So the impact of this is continuously changing and growing, and it's quite devastating for the UK, unfortunately.
It's also devastating, I would assume, for international air travel, which has taken a horrific beating. London is what? The primary airport, one of the primary airports in the world. And therefore, if you don't have airlines working out of them, whether it's airlines out of the UK or airlines flying in, this would take a huge hit on airlines trying to recover.
Absolutely. I mean, as I say, travel companies like the German company TUI, they're down about 11% in the stock price today. And we see these global hubs just screeching to a halt, and it's really such a shame. And on top of that, there's the human element to think about as well. There's people traveling home for the Christmas period and New Year, people wanting to get away for winter breaks. This isn't happening anymore. Departing the UK for winter sun or some skiing, that's just been completely wiped out so far this year.
To put this in perspective, to the best of your knowledge, would this be the first time since the Second World War that we don't see flights coming out of the United Kingdom?
To the best of my knowledge, there might have been a pause after 9/11, and I think after 9/11 it took the industry about 4 years to recover from that hit, and that's when we saw a 54% decrease in the kind of numbers. Already this year, we've seen the industry hit by the travel and tourism industry hit by 74%. So coming out of that kind of slog, that hit that they've seen is going to probably take them much longer than after 9/11.
All right, Hilary Hudson, thank you very much for sharing those somber thoughts with us. International aviation taking a huge hit as a result of this new mutant strain. Thanks very much indeed. Spreads of the new mutated variant of the COVID virus, there is a huge concern on what exactly it could mean for millions around the world. Joining us now, Professor Devi Sridhar, Professor and Chair of the Global Public Health Unit at Edinburgh University's Medical School. Thank you very much for being with us, Professor Sridhar. What makes this particular mutation more dangerous than others?
Well, there are three things you're looking for when there's a mutation now. The first is, does it transmit more easily? Is the doubling time faster because it's harder to suppress? The second is it have worse health outcomes? Do you have younger people affected or more hospitalizations? And the third is, could it evade our existing vaccines, given we have three? And we know so far with this one, it does seem to have a faster doubling time. It transmits more easily, but we don't yet know the impact on health outcomes or potentially what it could mean for vaccines.
But tell us a little bit about vaccines, because there are two sets of beliefs. A lot of scientists believe that what we have presently should be good enough for us to tide over this crisis. There are others who say it's too early. Where do you stand on this?
Well, I think the true answer is I don't think any scientist can say for sure because we don't have the information. So the people who are saying they think the vaccine will be enough, it's because we have a vaccine that seems to have a robust antibody and T-cell response, and they don't see this mutation as being significant enough to actually, change that. They see it as a variant, a slight divergence, rather than a whole entire new strain. So I think we don't know. I think we need to go forward with vaccinations. It's one of our few ways forward. And in the meantime, also keep an eye out for new mutations of this virus, because it could mean in future years we will have to develop new vaccines similar to flu rather than just have one vaccine we can use for forever, let's say.
There are already hundreds of mutations of COVID which have already taken place. Is it the fact that the spike protein and the 7 mutations which have appeared on the spike protein this time around make it potentially, not potentially, make it definitely more receptive to human beings? Is that what the key issue, the science behind it is?
Yes, exactly. I think the issue is that we are seeing in England a steep rise in infections in the southeast and London, where this new variant has been identified. And in the UK, all samples which test positive are sequenced to understand actually which exact strain it is. And doing that, they're seeing a huge rise in this particular one. And so that leads to the modeling to say this one is about 70% more transmissible than other ones we had previously. It's going to be hard to suppress, and that's the worry, which is, are the existing restrictions going to be enough, or do we need to have harsher ones to make sure we don't see increased growth in numbers?
Professor Sridhar, sequencing is something which is key. Now, this virus, this variant, would not show up as a different variant in standard RT-PCR tests, but sequencing is a lot more complicated, isn't it? So is it not a strong possibility that this is actually spread all over the world and people don't know it's really hitting them because they haven't sequenced it in as much as some countries, for example, Denmark does?
Exactly. I think that's a very important point, which is where we are seeing this, variant being identified is in places which have more advanced sequencing. So it's perfectly rational to think it has already spread to many countries across the world, and they now need to build up, their sequencing to be able to identify it and make sure that they're actually catching it if it is transmitting more easily. We're also seeing in South Africa a new strain which seems to also transmit quite easily, especially among young people. So we are going to see different mutations and different strains across the world. It's a difficult situation, especially if we want to keep on top of it, given how much virus we have circulating across the world and the likelihood we are going to see continual new strains and variants developing.
And Professor Sridhar, to the best of your understanding, the mutation that we see in South Africa, how is that different from what we are seeing in the United Kingdom, or is there a strong possibility that it's essentially the same?
Well, there's a fantastic researcher, Dr. Emma Horcroft, and she's looked at this and says actually that they're separate strains. So it's not like it's the same one we're seeing in the UK and South Africa, but having kind of similar changes to the actual virus RNA. And so this is where you have to see it as a matter of chance. The more virus you have circulating, the more it's jumping across people and across species. We've also seen it go into minks in Denmark and come back into humans in a different form. Luckily, that seemed to have been handled quite quickly, though we're still waiting to see if more of that will emerge. It just shows how fragile the situation is. And in South Africa, that one seems to have worse health outcomes for younger people. We're not yet seeing that in the UK, though they are monitoring it over the next few weeks to see what it means in terms of hospitalizations.
Is it true that mutations start happening in larger numbers and potentially being more deadly because of the number of people who are infected? The more that the virus lies in a large number of human beings, the more there is the possibility of mutation. Is that again a part of the science?
Yes, definitely. And this is why it comes back to that message of suppression, of keeping those numbers low, to not give the virus the opportunity to keep changing. And I think here as well, we need to look very carefully at animals and the animal-human dynamic, because we are seeing this virus jumping quite easily across species. It jumps into mink, it jumps into felines like cats, tigers. We've seen it in so many, it comes from bats. We don't know if the intermediary was a pangolin. I mean, this is a virus that seems to jump very easily across mammals. And so we need to also be looking at how we're keeping animals and factory farming and this emerging in those kind of settings, because then we might get a radically different strain, which would be a larger challenge than we have now in terms of vaccines and also our diagnostics.
Professor Sridhar, this is an elementary question, but I think a lot of our viewers would want to know, why do viruses mutate?
Well, it's just a natural occurrence, and there's also self-selection involved. So, for example, if you have a virus that kills people in the first 2 days or makes them extremely ill, it's not going to spread that easily and it dies out. A kind of perfect, in terms of evolutionary advantage virus, would be one like SARS-CoV-2, where you have some people who become very ill later on, but you actually have the bulk of people who are asymptomatic or have mild symptoms and might pass it on to others. So in some way, you know, this virus has hit the sweet spot in the sense of it's not innocuous enough. It's not like our common cold, which will just keep circulating and we get it and we might get it repeatedly in our lifetimes, but we don't really have people dying of it or getting seriously ill. And at the same time, it's not as severe as something like Ebola, where 70 to 80% of people will die without medical care, and therefore it's easier to contain because people will not be walking around infecting others because they're very ill. So it's a really tricky situation, but obviously there's different mutations arising, and then several of those have an evolutionary advantage, and they tend to spread more quickly.
How long could it potentially take to revise some of the vaccines out there already?
Well, scientists are saying that they could do this. It's possible from a research and a scientific perspective. The main challenge is manufacturing enough doses, because one of the fascinating things with this vaccine race is Pfizer, Moderna, AstraZeneca, others as well, started manufacturing doses even before trial 3 was done. So they could have those hundreds of doses, those hundreds of millions of doses ready to go, which they have been starting to get out. In the UK, we've had over 100,000 people vaccinated already. So the challenge is not just formulating the vaccine, it's in getting that into the pipeline to manufacture enough doses. And it's and they've been doing this for months in terms of the factories. So it'll put us back, definitely several months, but I don't think we're there yet. I don't think people should worry about that. I still think we should continue with our vaccination programs, and because all signs are showing that, if all goes well, this should be protective against this new strain too.
And in a situation like this, do you believe flight bans, not just necessarily from the United Kingdom out, but around the world, are an immediate step that's required? I again ask this because we hesitated, the world hesitated the first time around. And now we are in that same sort of situation. We know as a fact that this is deadly, this 70% transmissibility. This being the case, what's the smart move as far as governments are concerned?
Yeah, so my mind's been changed on this. If you had asked me this back in January, I would have said they don't show much effectiveness. If you ask me now, after watching this pandemic play out, the countries that have had more severe travel restrictions and checks at their borders have done better. That's clear. It has been impossible to suppress this without actually checking those coming in. So I think we are already seeing, I think just announced, India has asked flights to stop to the UK. Britain is fast becoming a real island with many countries stopping all travel in or out. It is a way to buy time. It's not a silver bullet. It's not going to mean it's never going to arrive, but it gives you time to prepare, to build up the labs, to build up the testing at your airports, to get the infrastructure in place, and puts you in a better position. So I actually think travel restrictions are one of the few ways we have now to control this if we look at this pandemic so far.
And a final question, if you do look at control, logically it could take months before this is controlled in the United Kingdom. Just the pace of administering the vaccine, assuming that it works as effectively, will take months. That being the case, could we have this extended lockdown in the United Kingdom, a possible extended travel ban as well for months?
Possibly. I mean, it really depends if they're able to get a handle on this new variant. So we had been able to manage with the previous strains, which weren't as infectious, to have kind of low-key restrictions, testing and tracing, and somehow to keep a handle on this, also being in the summer months. I think the growth we're seeing is really exponential growth. And if even those kind of moderate restrictions aren't working, we're going to have to go into harsher restrictions, because the faster the virus spreads, the more people who are going to become infected means more people who need beds, facilities, staff and hospitals. And all of a sudden your health services become crunched because they don't have enough space to be able to take in everyone who needs care. And it forces governments into very harsh lockdowns to ask people to stay at home. So that's unfortunately what might happen if they're not able to get a handle on it. But the vaccine will have to be rolled out at the same time. In a way, it's a race between getting the vaccine into people's arms faster than actually this virus can infect people.
Professor Sridhar, I wish we could have interviewed you in better times. This almost seems like a parting kick from 2020. Be that as it may, we really have to fight this. Thank you so much for sharing your understanding of the science in such simple terms for us to understand. Thank you very much indeed.
Thank you very much.